Welcome to week 18 of your 40-week pregnancy journey. It's hard to believe that you're almost at halfway point. Even though you and yours have known about the baby to be for a while, your pregnancy is now more noticeable to those around you. Your baby's development at week 18. At 18 weeks pregnant, your baby is around the size of a sweet potato, measuring around 5.5 inches long from crown to rump and weighing around 7 ounces. The developing digestive system has been going through its paces for several weeks already. Your baby swallows amniotic fluid, which makes its way through the stomach and intestines. That fluid will combine with dead cells and secretions in the intestines to form meconium, a small black terry substance you'll see at the very first diaper change. At around 18 weeks, your baby's ears will begin to stand out from the sides of the head and may even begin to register sounds. Your baby will need bile to digest nutrients, and at 18 weeks, the gallbladder may begin to work. During this week, you might feel the odd movement as your baby practices kicking and flexing his tiny limbs. During this week, you can also check your baby's heart rate via a sonograph. The sonograph will show you that your baby's heart beats around 120 to 160 beats per minute. Your common symptoms this week. If you are a first-time mom-to-be, this may very well be the week that you can begin to experience quickening or baby's kicks. Right now, your uterus is continuing to expand, making your pregnancy more and more likely to be visible. Number 1. Edema. During pregnancy, edema occurs when body fluids increase to nurture both you and your baby and accumulate in your tissues as a result of increasing blood flow and pressure of your growing uterus on the pelvic veins and your vena cava. This causes you to experience necessary increase and annoying swelling also, particularly swollen ankles and feet. Number 2. Leg cramps. Various theories blame fatigue from carrying pregnancy weight, compression of the blood vessels in the legs and possibly diet, an excess of phosphorus and a shortage of calcium or magnesium. These painful spasms that radiate through the calves and up the leg are very common among the expectant set. Number 3. Bleeding gums. Several factors could be contributing to your swollen gums and sore mouth during pregnancy, such as surging hormones, swelling gums, changes to your mouth and eating habits, delayed reaction to morning sickness, your newly finicky senses. Due to these reasons, your gums may also be extra tender, swollen, red, sensitive and prone to bleeding during pregnancy, especially when you brush and floss. So here are some self-care tips during this week. The symptoms you experience during this week can cause you a lot of trouble, and to get a relief from them, you must try out the following things. Number 1. Avoid edema. To avoid edema and swelling in the feet, you should avoid long periods of standing or sitting, kick up your feet, sleep on your side, avoid too tight elastic top socks or stockings, wear comfy shoes, try support hose, drink lots of water. Number 2. Preventing leg cramps. Stretching exercises can help stop cramps before they strike. Before your head to bed, alternate periods of activity with periods of rest throughout the day. Put your feet up as often as you can when you are seated. Make sure you're drinking at least 12 to 13 glasses of fluids a day, and talk to your practitioner to find out if you should be taking a magnesium supplement before going to bed. Number 3. Preventing bleeding gums. Some simple steps that you can do to deal with bleeding gums include: get your teeth checked by a dentist, take care of your teeth by brushing them regularly and flossing them, brush your tongue as well, remember to rinse. If you're suffering from morning sickness during pregnancy, eat right, make sure you get plenty of vitamin C in your diet, which strengthens the gums and helps them to stay healthy. Eat healthy and nutritious snacks and chew your meal properly. So in the nutshell, here is your week 18 checklist. Continue taking prenatal vitamins. Continue drinking about 8 to 12 glasses of water a day to stay hydrated and prevent other dental problems. Replace everyday heels with more comfortable flats or shoes while exercising or walking. Begin researching baby's pediatrician. Thank you. Please like, subscribe and share our YouTube channel, The Voice of Woman, and press the bell icon to stay tuned for the latest updates.